Your braces oral hygiene routine is important to the success of your orthodontic treatment. It consists of brushing, flossing, and mouthwash. Start with brushing first. Brush after every meal and snack if possible. Brushing at night is the most important to prevent plaque buildup overnight. You'll need 3 brushes to get the job done. 1. A Proxa brush. 2. A manual orthodontic toothbrush or power brush. And 3. A sulca brush or power tip. Start with a Proxa brush to remove chunks of food that are stuck between your teeth and braces. The next brush you'll need is either a manual orthodontic toothbrush or a power brush. There are 3 brushing positions you'll need to use for each side of each tooth. A 45-degree angle on the tooth and gum line pointing from the gum toward the tooth. A straight angle on the surface of the bracket. A 45-degree angle from the tooth toward the gum that targets under the bracket. With a power brush, hold the brush in each position for at least 5 seconds, then move on to the next tooth. If you're using a manual orthodontic toothbrush, move the brush in a circular motion. We recommend 5 circles for each brushing position. Don't forget to brush all sides of your teeth using the same 3 positions, as well as the chewing surfaces of your teeth, by positioning the brush on top of the chewing surface. You're almost finished. When you're done with your regular toothbrush, use this narrow sulca brush, or replace the head of the power brush with a smaller power tip. A sulca brush, or power tip, is great at getting under the brackets and at the gum lines. Repeat all 3 positions on the front and back of each tooth. Make sure to spend time with each tooth to ensure a thorough cleaning. Voila! You're done. Don't forget, moist objects attract bacteria. It's important to keep your brush in a clean and dry environment and to change your brush frequently. Use these brushing with braces tips every day for the duration of your orthodontic treatment. After brushing, remember to complete your braces oral hygiene routine with flossing and mouthwash. Once you've brushed, flossing is the next step in your braces oral hygiene routine. Make sure to floss once a day, preferably at night. Flossing is important to help get rid of food that gets stuck between your teeth and under the gingiva, your gums, forming plaque. To floss, you'll need dental floss. Some people also use a floss threader. Don't use a water pick instead of flossing. A water pick can be used to remove chunks of food, but you still need to floss because a water pick won't get under the gums. Here's how to floss with braces. If you're using a threader, thread a piece of dental floss through the loop on the floss threader. Take the stiff, narrow end of the floss threader and place it under the wire and pull the floss through. Your threader can be reused. Just rinse it off and let it dry on a tissue or towel. If you're not using a threader, you will need to feed the floss under the wire by hand. Once the floss is behind the wire, hold onto each end of the floss with both hands, keeping the floss fairly taut. Then gently seesaw the floss toward the gum line. Once the floss is near the gums, floss one side making a C shape a couple of times. Then floss the other side making a C shape in the opposite direction. A C shape protects the gum from being cut and helps to remove plaque from the sulcus, the area between the teeth and gums. To remove the floss, gently pull the floss through the wire and out of your mouth. Re-thread the floss and move on to the next tooth. If you have a bonded retainer, a wire that goes behind your teeth after your braces have been removed, it's important that you use this flossing technique as well. If you accidentally knock off a bracket or bend or pull off a wire while flossing, do not panic. Contact your orthodontist office as soon as possible to book an appointment. After flossing, it's important to use an antiseptic mouthwash and swish for about 2 minutes, then rinse with water. Good night.